Hi, Bee and Buddy here. As you know, we're doing capillary refill, skin turgor, and belly sounds. So I have my handy dandy sweep watch that's hooked to me, my stethoscope, and we're going to listen high-low in all four quadrants on both sides of him. He is tied up in his new pen, which he seems to be loving. So here's his nice big belly. Nice hay belly. I'm going to listen upper and lower on both sides. Put my stethoscope in, check in here. Go into the other side. And I got all the good action right up front. He just had a bunch of grain and some grass, so his tummy's making all those good gurgly sounds. Now what I'm going to do is I'm going to take him right here on his neck. I'm going to check his skin turgor, push it up, and then you see it comes back down. Up, 1,000, 2,000. So he's got good skin turgor. And here, look at his gums. They're nice and pink and shiny. I can press on him, and I get good color return. And he's a licker. He's a good boy. Alright, we have Buddy here tied up. He is a 20-year-old quarter horse, and if I were just getting him, of course I'd want to have any medical records that he has, any immunizations, warming schedule, any injuries. And when I got him, he was a sanctuary donation. He was my workhorse, so he was kind of what was left over because I got there late. So I knew that he hasn't had a lot of medical care, and I knew that he had been worked really hard. So for his health assessment, of course, I would look at his teeth and his gums. I would look in his nose, I'd look in his eyes. He's got a right eye blindness. He's got left eye cancer. That's obvious on examination. It's got an area on the lower part, and he's got pink around his eye, so he's susceptible to it. On him, his conformation, I would want to walk him around, see him move. I know with him, he has, immediately you notice, he has large carpus joints. They've just been injected with polyacromide. He was lame when I got him. On his feet, he has an okay shape right now. He's getting farrier care, which he had not got routine farrier care, so he had really spoon-shaped hooves, and they were, he's pigeon-toed. So I would also examine underneath his feet, look at his frogs, and look at what's going on down there, look for any deformities, abscesses, or abnormalities. I would go over his body and palpate his entire body just to kind of get a curiosity sense of where he's sensitive and not. I know he's sensitive back here in his left hock. He has a right hock, I'm sorry. He has a right fetlock injury that we suspect was at his yearling age. So they think he might have had a fracture. So his right rear hocks out when he walks. I would look at him from all sides. Front, back, look at him move. Doing all the vital signs that we did and making sure those were all within normal range. Also, you know, for me, I would go ahead and get a vet eval if he were a new horse to me. Checking on him and make sure he doesn't have any glands that are inflamed. We're just dealing with a case of strangles, so it's important for new animals to get a vet health check as well as do isolation. He's not face sensitive at all. He's not sensitive. He's pretty good, solid horse. His body looks much better. And you know, on a scale, he's probably a little on the fat side, which I'd rather have than too skinny, because I got him too skinny. He's been examined for Cushing's disease. He's negative for Cushing's. Being an older horse, that would be something I'd want. I just did an egg count on him. That would be something, as I would want to see what their manure looks like and find out any history of things like colic or choke. He has a history of choke. That's primarily on alfalfa pellets, and I have to believe largely related to his ability to chew food before I got him. Checking and making sure that his teeth has been floated, his sheath has been cleaned, he's a gelding. So I kind of do a once-over from nose to tail. I know on him he's got a weird hacked-off mane. That was not my doing. It was done before I got him. His tail's been hacked off because he had diarrhea, and instead of cleaning it out, they just hacked it off. So I've been working on growing his hair, giving him good vitamins for that. I got him a tail bag, and that'll be the next thing I do. So he's in good health. I've got vet evaluation from him and got a positive health certificate. Now that he's got the polyacromide in his joints, I'm going to start this next week. A matter of fact, Saturday, I can saddle him. He was attacked when I moved him here a week ago. Those wounds are in process of healing, so I'll be able to put a saddle on him and maybe do some light arena riding tomorrow. He has a lesson on Sunday with an 8-year-old little girl. I think he's ready to go for that. Thanks.